Hi guys, my paper is on myasthenia gravis. Many people have never even heard of myasthenia gravis. Few people may actually know someone who suffers from this disorder. I am one of the few who knows someone with this disorder, but she is in remission and has been for years. This condition is rare, affecting fewer than 200,000 people in the United States per year. Myasthenia gravis comes from the Greek and Latin words meaning grave or serious muscular weakness. It is a chronic autoimmune neuromuscular disorder that is characterized by fluctuating weakness and rapid fatigue of the voluntary muscle groups caused by a breakdown in the normal communication between nerves and muscles. It affects the skeletal muscles, which are responsible for breathing and moving parts of the body, including the arms and legs. Muscles that control eye movement and eyelid movement, facial expression, chewing, talking, and swallowing are often involved. Weakness and drooping of one or both of the eyelids is the most noticeable first symptom. It can also cause blurred or double vision, shortness of breath, and impaired speech. This muscle weakness worsens after periods of activity and improves after periods of rest. Not everyone will have every symptom, and the degree of weakness can change from day to day. If left untreated, the symptoms usually increase over time. Myasthenia gravis is caused by an error in the transmission of nerve impulses to muscles. It occurs when normal communication between the nerve and muscle is interrupted at the neuromuscular junction. The neuromuscular junction is the place where nerve cells connect with the muscles they control. Normally, when electrical signals or impulses travel down a motor nerve, the nerve endings release a neurotransmitter called acetylcholine. Neurotransmitters are chemicals that neurons or brain cells use to communicate information. Acetylcholine travels from the nerve ending and binds to acetylcholine receptors on the muscle. This binding of acetylcholine to its receptor activates the muscle and causes a muscle contraction. In myasthenia gravis, antibodies block, alter, or destroy the receptors for acetylcholine at the neuromuscular junction, which prevents the muscle from contracting. This is caused by antibodies to the acetylcholine receptor itself. Antibodies to other proteins, such as muscle-specific kinase protein, can also lead to impaired transmission at the neuromuscular junction. These antibodies are produced by the body's own immune system, so the body mistakenly attacks itself. The thymus gland, which is located in the chest behind the breastbone, controls immune function and may be associated with myasthenia gravis. Throughout childhood, the thymus plays an important role in the development of the immune system because it is responsible for producing T cells. T cells are a white blood cell that protects the body from infections. The thymus is largest in children and continues to grow until puberty, then gets smaller and is replaced by fat. In adults with myasthenia gravis, the thymus gland is large and has clusters of immune cells similar to lymphoid hyperplasia, a condition that usually only happens in the spleen and lymph nodes during an active immune response. Some people with myasthenia gravis develop thymomas, which are tumors of the thymus gland. Thymomas can become malignant or cancerous, but are mostly harmless. Myasthenia gravis affects both men and women and occurs across all racial and ethnic groups. It is most common in women under the age of 40 and men over 60. It is not inherited, nor is it contagious. It can be diagnosed by several tests, including a physical and neurological exam, an edrophonium test, a blood test, electrodiagnostics, diagnostic imaging, and pulmonary function testing. The diagnosis is often missed or delayed. Treatment consists of symptom management. There are several ways to help reduce and improve muscle weakness, including a thymectomy or removal of the thymus, anticholinesterase medications, immunosuppressive drugs, plasmapheresis, and intravenous immunoglobulin. Medications improve muscle strength by suppressing the production of abnormal antibodies. The use of medications must be carefully monitored by a physician because they may cause serious side effects. With treatment, most people can improve their weakness and lead nearly normal lives. Sometimes a severe weakness may cause respiratory failure, which requires immediate care. This is a myasthenia crisis. A crisis can be triggered by infection, fever, or an adverse reaction to medication. Some cases of myasthenia gravis may go into remission and medications can be discontinued.